Hello everyone! Before we start, make sure to like and subscribe to the channel and leave a comment with where you're from and what time you're watching. That way, YouTube will keep showing you stories just like this one. Now, let's begin. I'm a radiologist at Presbyterian Medical Center in Dallas, Texas, or at least I was until I submitted my resignation last month. You can call me Dr. Sarah Chen if you want. Though most people in the radiology department just called me the film reader during my 15 years there. I've seen everything you can imagine in diagnostic imaging: broken bones, tumors, internal bleeding, foreign objects in places they shouldn't be, and every kind of abnormality the human body can produce. But what I'm about to tell you about is the one case that made me question everything I thought I knew about medical imaging and ultimately led me to leave the profession entirely. The Presbyterian Medical Center is a Level 1 trauma center serving the Dallas-Fort Worth metropolitan area. It's a massive facility built in the early 2000s with one of the most advanced radiology departments in Texas, handling over 200,000 imaging studies per year. During my time there, I worked primarily day shifts, 6 a.m. to 6 p.m., because I preferred the steady flow of routine cases mixed with the occasional emergency that kept things interesting. Day shifts in radiology are predictable in their unpredictability. You might spend 2 hours reading routine chest X-rays and mammograms, then suddenly get called to interpret emergency scans for a multi-vehicle accident or stroke patient. The morning of March 22, 2023, started like any other. I arrived at the hospital at 5:45 a.m., grabbed my usual black coffee from the cafeteria, and settled into my reading room with its wall of high-resolution monitors. The first few hours were routine: a construction worker's hand X-ray showing a clean fracture, an elderly woman's chest CT revealing pneumonia, and a teenager's knee MRI after a soccer injury. Standard cases with clear diagnoses and straightforward treatment plans. It was around 10:30 a.m. when my pager buzzed with a message from our lead technologist, Marcus Rodriguez, who had been working in the department for almost 25 years and was known for his calm professionalism even during the most hectic emergency situations. The page simply said, "Priority chest X-ray from ER. Patient in Trauma Bay 3, needs stat read." I pulled up the imaging request in our computer system. The patient was listed as Jane Doe, approximately 25 to 30 years old, brought in by paramedics after being found unconscious in Clyde Warren Park downtown. The clinical information was sparse: unresponsive female, unknown medical history, no identification, suspected drug overdose. The emergency physician, Dr. Michael Torres, was requesting a chest X-ray to rule out aspiration pneumonia, a common complication when someone is found unconscious and may have vomited while unresponsive. I opened the X-ray file expecting to see a routine chest image, maybe with some fluid in the lungs or signs of infection. What appeared on my monitor instead made me stop mid-sip of my coffee and lean forward in my chair. The image was technically perfect: crystal clear resolution, proper positioning, optimal exposure settings. But what I was looking at defied every principle of human anatomy I had learned during my medical training and 15 years of practice. The patient's ribcage was completely normal on the right side: 12 ribs, properly spaced, with normal curvature and bone density. But on the left side, there were 14 ribs. Not malformed ribs, not fractured ribs that had healed incorrectly, but 14 perfectly formed, symmetrical ribs that appeared to be completely natural and healthy. The additional 2 ribs were positioned exactly where you would expect them to be if humans normally had 14 ribs on each side. They weren't causing any crowding or displacement of the other structures. They simply existed as if they had always been there. I had seen plenty of congenital anomalies during my career: cervical ribs, which are extra ribs that sometimes form near the neck area; bifid ribs, where one rib splits into 2 branches; even cases where patients were born missing ribs entirely. But I had never seen anything like this: additional ribs that were so perfectly formed and positioned that they looked like they belonged to a different species entirely. I immediately called up the patient's lateral chest X-ray, the side view that would give me a better perspective on the rib structure. The lateral view confirmed what I was seeing on the front view and added even more puzzling details. Not only were there 14 ribs on the left side, but the spacing between all the ribs was perfect. In normal human anatomy, when there are extra ribs, they usually cause crowding, pushing other structures out of their normal positions. But this patient's extra ribs seem to have created additional space for themselves without affecting anything else in the chest cavity. I checked the patient identification information 3 times to make sure I wasn't looking at someone else's X-ray by mistake. The name, medical record number, and timestamps all matched the request from the emergency department. I even called down to radiology to verify that the correct patient had been X-rayed and that there hadn't been any mix-up with the images. Marcus confirmed that he had personally performed the X-ray on the patient in Trauma Bay 3, a young woman with no identification who had been brought in unconscious. He also mentioned something that made my skin crawl. "Dr. Chen, I've been doing this for 25 years, and I've never had a patient lie so perfectly still during an X-ray. Most unconscious patients still have some involuntary movement, some breathing artifact that creates slight blurring in the image. But this woman was absolutely motionless. The image quality is so perfect it almost looks artificial. I spent the next hour reviewing every detail of the X-ray images. I measured the rib angles, checked the bone density, examined the lung fields, and analyzed every millimeter of the chest cavity. Everything appeared completely normal, except for the presence of 2 extra ribs that shouldn't exist. The lungs were clear with no signs of infection or fluid. The heart was normal in size and position. Even the diaphragm and other soft tissue structures appeared completely healthy. But as I continued my analysis, I began to notice other subtle abnormalities that were even more disturbing than the extra ribs. The patient's bone density was remarkably uniform throughout the entire skeletal structure visible on the X-ray. In normal human bones, there are always slight variations in density due to age, activity level, previous injuries, and individual genetic factors. But this patient's bones showed a level of uniformity that I had never seen before. It was as if every bone had been manufactured to identical specifications. The heart shadow on the X-ray was also unusual. Not abnormal in a way that would indicate disease, but unusual in its perfection. The cardiac silhouette was textbook perfect, with ideal proportions and positioning that you might see in an anatomy textbook, but rarely in real patients. Real hearts have slight irregularities, minor variations in shape and size that make each person's cardiac shadow unique. But this patient's heart appeared to match the idealized anatomical drawings I had studied in medical school. I decided to call Dr. Torres in the emergency department to discuss my findings and get more information about the patient's condition. When I reached him, he was in the middle of examining the patient and sounded frustrated and confused. "Dr. Chen, I'm glad you called. This is the strangest case I've encountered in 12 years of emergency medicine. The patient is technically stable, but nothing about her presentation makes sense. She's breathing normally, her vital signs are perfect, but she's completely unresponsive to any stimuli. We've run blood tests, urine tests, and a tox screen. Everything comes back completely normal. No drugs, no alcohol, no signs of infection or metabolic abnormalities. I asked him about the patient's physical appearance and whether he had noticed anything unusual during his examination. That's the other thing, Dr. Torres said, lowering his voice. She looks like she could be a model or an actress. Perfect symmetrical features, flawless skin, ideal body proportions. It's almost for someone who's been unconscious. Usually, unconscious patients have some degree unsettling how physically perfect she appears. And her muscle tone is remarkable of muscle laxity, but her muscle tone is like that of an elite athlete. I explained my X-ray findings to Dr. Torres, describing the extra ribs and the unusual uniformity of her bone structure. There was a long pause before he responded. 14 ribs on one side? That's medically impossible, isn't it? I mean, I've never heard of anything like that occurring naturally. Neither had I. But I was looking at clear evidence that it was happening. I asked Dr. Torres if I could come down to examine the patient in person. Something about this case was bothering me beyond just the medical anomalies, and I needed to see her for myself. When I arrived in Trauma Bay 3 10 minutes later, I understood immediately what Dr. Torres had meant about her physical appearance. The patient was lying perfectly still on the examination table, her breathing so regular and controlled that it almost seemed mechanical. Her skin had an unusual quality to it, not pale like most unconscious patients, but with a subtle luminescence that made it appear almost porcelain-like under the harsh fluorescent lights. But it was her facial features that really unsettled me. Dr. Torres was right about the symmetry being perfect, but it was more than that. Every feature seemed to be the ideal version of itself. Her nose was exactly the right proportion for her face. Her eyebrows followed perfect arches. Even her hair, which should have been disheveled from being found unconscious in a park, lay in perfectly arranged waves around her head. "Has anyone been able to identify her yet?" I asked Dr. Torres as we stood at the foot of her bed. "That's another strange thing. She has no identification, no jewelry, no personal belongings at all. The clothes she was wearing were generic. No brand labels or identifying marks. We ran her fingerprints through the system, but no matches came up. It's like she doesn't exist in any database anywhere." I moved closer to examine her more carefully. Her hands were positioned at her sides with perfect symmetry, fingers slightly curved in identical positions. I had never seen an unconscious patient maintain such precise body positioning. Usually, unconscious patients have some degree of asymmetry in their posture, some indication that gravity and muscle relaxation are affecting their positioning naturally. "Dr. Torres, have you tried any pain stimuli to test her responsiveness?" "We've tried everything: sternal rubs, pressure on the nail beds, even inserted an IV catheter. She shows no response to pain whatsoever, but her vital signs never change. It's like her body doesn't register pain at all." I asked if I could perform a quick neurological assessment. Using my pen light, I checked her pupils. They were perfectly round, equal in size, and reactive to light, but the reaction was unusual. Instead of the normal gradual constriction you see when light hits the pupil, hers contracted in a precise, almost mechanical way, like the aperture of a camera lens. Her reflexes were equally strange. When I tested her knee-jerk reflex with a reflex hammer, the response was textbook perfect. Not just normal, but exactly the response you would expect to see in a medical demonstration. The same was true for every reflex I tested. Each one was perfectly calibrated, as if her nervous system had been programmed to respond in exactly the correct way. "Dr. Torres, I think we need to run more imaging studies. I'd like to get a full-body CT scan and see what else we might be dealing with." He agreed, and we arranged for the patient to be transported to the CT scanner. As the technologist prepared her for the scan, I noticed something that made my blood run cold. When they moved her from the gurney to the CT table, her body maintained its perfect positioning. Most unconscious patients show some degree of limpness when moved, some natural settling of limbs due to gravity and muscle relaxation. But her body moved like a single rigid unit, maintaining its symmetry and positioning throughout the transfer. The CT scan took about 30 minutes to complete, and I watched the images appear on the monitors in real time as the scanner captured cross-sectional views of her entire body. What I saw challenged everything I thought I knew about human anatomy and physiology. Every organ in her body was perfectly positioned and ideally proportioned. Her brain showed no signs of swelling, injury, or abnormalities, but the symmetry was unnaturally perfect. The two hemispheres were identical mirror images of each other, which never occurs in normal human brains. Real brains have subtle asymmetries that develop naturally during growth and development. Her heart was centered perfectly in her chest cavity, with chambers that were exactly the right size and walls that were uniformly thick. Her liver, kidneys, spleen, and other organs all appeared to be textbook perfect examples of ideal human anatomy. It was as if someone had taken an anatomy atlas and created a living version of the idealized drawings. But the most disturbing finding was in her skeletal system. The extra ribs I'd seen on the chest X-ray were just the beginning. Her entire skeleton showed additional bones that shouldn't exist in human anatomy, extra vertebrae in her spine that didn't cause any crowding or displacement, additional small bones in her hands and feet that were perfectly integrated into her overall skeletal structure. I had seen thousands of CT scans during my career, and I had never encountered anything that even remotely resembled what I was looking at. This wasn't a case of congenital abnormalities or genetic mutations. This appeared to be a completely different type of human anatomy, as if she belonged to a subspecies that had evolved along a different path. I called in Dr. Patricia Williams, our chief of radiology, to review the images with me. Dr. Williams had over 30 years of experience and had consulted on some of the most unusual cases in medical literature. When she arrived and began examining the CT images, her expression grew increasingly troubled. "Sarah, I don't know what we're looking at here, but this isn't normal human anatomy. The bone structure, the organ positioning, the symmetry, it's all too perfect. It's like someone designed an ideal human body and somehow made it real." We spent the next 2 hours going through every image, measuring structures, comparing proportions, and trying to find any explanation for what we were seeing. Dr. Williams suggested we contact specialists at UT Southwestern and other major medical centers to see if anyone had encountered similar cases. That's when things took an even stranger turn. As we were discussing our next steps, Marcus called from the CT control room with urgent news. "Dr. Chen, Dr. Williams, you need to get back here immediately. Something's happened with the patient." We rushed back to the scanner room to find the CT table empty. The patient was gone. The technologists were standing around looking confused and frightened. "Where is she?" Dr. Williams demanded. "We don't know," said Jennifer, the lead CT tech. "We completed the scan and we're waiting for you to review the images before moving her back to the ER. I stepped out for maybe 2 minutes to get the contrast agent we didn't end up needing. When I came back, she was gone." "Did anyone see her leave? Did she walk out on her own?" "That's impossible. She was completely unconscious. There's no way she could have just gotten up and walked away. And besides, she was wearing a hospital gown. Someone would have noticed a patient wandering the halls in a hospital gown." Security was called immediately, and they began reviewing camera footage from the radiology department and surrounding areas. What they found was impossible to explain. The cameras showed the patient being wheeled into the CT room on a gurney. They showed the technologist positioning her on the scanner table, but there was no footage of her leaving the room. More disturbing was what the security footage revealed about her time on the CT table. While the scan was running, the cameras captured something that none of us had noticed in person. For just a few seconds, as the scanner was taking images of her head and neck area, her eyes opened. Not the gradual, disoriented eye opening you see when someone is regaining consciousness, but a sudden, alert opening as if she had been awake the entire time. Her eyes moved directly to look at the camera, and for those few seconds, her expression was one of complete awareness and intelligence. Then, just as suddenly, her eyes closed again, and she returned to her previous state of apparent unconsciousness. It was as if she had been monitoring her surroundings the entire time, waiting for the right moment to make her move. The hospital administration launched a full investigation into the disappearance. Security reviewed footage from every camera in the building, interviewed staff members, and even checked the roof and basement areas. There was no trace of where the patient had gone or how she had left the building. What made the disappearance even more unsettling was the discovery that all traces of her presence were systematically being erased. The blood samples that had been drawn in the emergency department were missing from the laboratory. The IV catheter that had been used to draw blood was gone from the medical waste container. Even the hospital gown she had been wearing couldn't be found in the laundry or disposal areas. Dr. Torres came up from the emergency department looking shaken and confused. "This is impossible," he said, reviewing the security footage with us. "I've been practicing emergency medicine for over a decade, and unconscious patients don't just vanish into thin air. Someone had to help her leave. But who? And why?" The investigation continued for days, but every lead ended in another dead end. The paramedics who had brought her in were interviewed extensively, but their story remained consistent. They had responded to a 911 call reporting an unconscious woman in Clyde Warren Park. When they arrived, they found her lying on a bench in the same perfect position we had observed in the hospital. No witnesses, no signs of struggle, no indication of how she had ended up there. The 911 call itself was traced to a payphone that was located 3 blocks from the park. The caller had identified themselves as a concerned jogger, but the voice on the recording was strangely monotone and mechanical, almost like a computer-generated voice. Phone company records showed that the call had been placed at exactly 8:47 a.m., but security cameras in the area showed no one using that payphone at that time. What disturbed me most was that I couldn't stop thinking about the CT images. I had made copies of all the scans before the patient disappeared, and I found myself reviewing them obsessively during my off hours. The more I studied the images, the more convinced I became that what we had encountered wasn't human in any conventional sense. I began researching similar cases in medical literature and online databases. What I found was a pattern of reports dating back several decades from hospitals across the country. Patients with impossible anatomy, perfect physical proportions, and mysterious disappearances. In most cases, the medical staff involved had been reluctant to publish their findings or discuss the cases publicly, citing concerns about professional credibility and career implications. Dr. Emily Watson, a radiologist at Johns Hopkins, had documented a case in 2019 involving a patient with additional vertebrae and perfectly symmetrical organ placement. Dr. James Muller at Mayo Clinic had reported a similar case in 2017 featuring a patient with extra ribs and unnaturally uniform bone density. In every case, the patients had disappeared before they could be thoroughly studied, and all physical evidence of their presence had vanished along with them. The most disturbing pattern was what happened to the medical professionals who had encountered these patients. Several had reported persistent anxiety, sleep disturbances, and an overwhelming sense that they were being watched. A few had left medicine entirely, citing burnout or loss of confidence in their abilities. Dr. Watson had resigned from Johns Hopkins 6 months after her encounter, and Dr. Muller had moved to a small rural practice where he no longer dealt with complex diagnostic imaging. I started experiencing similar effects myself. I would lie awake at night thinking about those perfect CT images, wondering what kind of being could have such flawless anatomy. During the day, I found myself second-guessing my interpretations of routine X-rays and scans, questioning whether I was seeing things that weren't really there or missing things that were. The breaking point came 3 weeks after the incident when I was called to interpret an emergency head CT for a car accident victim. As I pulled up the images on my monitor, I had a moment of panic when the brain anatomy appeared too perfect, too symmetrical. For several minutes, I was convinced I was looking at another case like our mysterious Jane Doe. It wasn't until Dr. Williams came to check on me that I realized I was having some kind of psychological reaction to the previous case. "Sarah, you've been staring at that screen for 20 minutes without saying anything. The emergency department needs this read immediately." When I looked at the images again, I could see that it was a completely normal head CT showing a typical brain injury from the accident. But the fact that I had initially perceived it as abnormally perfect made me realize that the previous case had affected my ability to interpret medical images objectively. I scheduled an appointment with Dr. Rachel Martinez, a psychiatrist who specialized in helping healthcare workers deal with traumatic cases. During our session, I described the mysterious patient and the effect the case had on my work performance and mental state. "Dr. Chen, what you're describing sounds like a form of post-traumatic stress specifically related to your professional identity. You encountered something that challenged your fundamental understanding of human anatomy and medical science. It's natural that this would create anxiety and self-doubt in your work." Dr. Martinez was professional and understanding, but I could tell she was having difficulty believing the medical details I was describing. When I showed her the CT images I had copied, her expression changed from professional concern to genuine bewilderment. "These images are remarkable," she said after studying them for several minutes. "I'm not a radiologist, but even I can see that this anatomy is unlike anything I've encountered in medical literature. Have you considered that there might be a rational explanation you haven't thought of yet?" I had considered every rational explanation I could think of. Genetic mutations, congenital abnormalities, imaging artifacts, even the possibility that someone had somehow manipulated the digital images to create false readings. None of these explanations could account for what we had observed, both in the imaging studies and in the patient's physical presentation. The most unsettling aspect was the growing certainty that the patient had been fully conscious throughout her time in our hospital. The security footage showing her eyes opening and looking directly at the camera suggested that she had been aware of everything happening around her. She had allowed us to examine her, run tests, and take detailed images of her impossible anatomy, then disappeared at the exact moment when we might have begun asking more serious questions about what she was. I started researching government databases and classified medical research, wondering if there were secret programs or experiments that could explain what we had encountered. The internet is full of conspiracy theories about genetic engineering, alien abduction, and government cover-ups. But I had never given much credence to such ideas. However, after witnessing something that defied conventional medical understanding, I found myself considering possibilities I would have dismissed just months earlier. What I discovered in my research was a network of medical professionals who had encountered similar cases and were quietly sharing information through encrypted forums and private communications. These doctors, nurses, and technologists had formed an informal support group for healthcare workers who had experienced unexplained medical phenomena. Through this network, I learned about dozens of similar cases spanning decades and involving hospitals across multiple countries. The pattern was always the same: patients with impossible anatomy, perfect physical proportions, mysterious origins, and sudden disappearances. In every case, the medical staff involved reported lasting psychological effects, and many had left their professions within a year of their encounters. Dr. Robert Kim, a neurosurgeon from Seattle, had encountered a patient with a brain structure that included additional neural pathways that shouldn't exist in human anatomy. Dr. Lisa Thompson, an emergency physician from Phoenix, had treated a patient whose blood work showed cellular structures unlike anything in medical literature. Each of these professionals had initially assumed they were dealing with some kind of rare genetic condition or medical anomaly. But the pattern of perfect anatomy and mysterious disappearances suggested something far more systematic. The most disturbing revelation came from Dr. Michael Chang, a pathologist who had performed an autopsy on a similar patient who had died during surgery. He reported that the tissue samples he had collected disappeared from his laboratory overnight, along with all records of the autopsy. Security cameras showed no one entering or leaving the pathology department during the time when the samples vanished. It's like someone or some organization is monitoring these cases, Dr. Chang told me during a secure phone conversation. They allow us to observe and document up to a point, then they clean up all the evidence and the patients disappear. I don't know who they are or what they want, but they have resources and capabilities that go far beyond anything I've ever encountered. This conversation took place on a Friday evening in late April, almost 6 weeks after my encounter with the mysterious patient. By Monday morning, I'd made the decision that would change the course of my career and my life. I could no longer function as a radiologist, knowing that there were things in the world that challenged everything I thought I understood about human biology and medical science. I submitted my resignation to Dr. Williams that Monday morning, citing personal reasons and the need for a career change. She was understanding but concerned, asking if there was anything the hospital could do to address whatever issues were affecting my work performance. "Sarah, you're one of our best radiologists. Your diagnostic accuracy has always been exemplary, and your colleagues respect your expertise. If this is about the unusual case from last month, we can arrange for additional support or counseling to help you process whatever happened." I appreciated her concern, but I knew that no amount of counseling or support could restore my confidence in conventional medical understanding. Once you've seen clear evidence that human anatomy can exist in forms that defy everything you've been taught, it becomes impossible to approach medical imaging with the same certainty and authority that the profession requires. I spent my final weeks at Presbyterian Medical Center trying to maintain some semblance of normalcy, but every scan I interpreted felt like I was looking through a filter of doubt and uncertainty. The routine chest X-rays that had once been straightforward now made me pause and examine every detail, wondering if I was missing something extraordinary hidden in plain sight. The pediatric imaging studies were particularly difficult because children's anatomy is naturally more variable than adults, and I found myself questioning whether normal developmental variations might actually be signs of something far more significant. My colleagues began to notice the change in my work patterns. Dr. Jennifer Walsh, one of the other radiologists, approached me during a coffee break in late April with genuine concern in her voice. "Sarah, you've been spending an unusual amount of time on routine cases lately. Yesterday you took 45 minutes to read a simple knee X-ray that should have taken 5 minutes. Is everything okay?" I tried to explain that I was being more thorough in my interpretations, but the truth was that I couldn't shake the feeling that every patient might be another case like our mysterious Jane Doe. The perfect symmetry I'd observed in her anatomy had become a benchmark that I unconsciously applied to every image I reviewed. When I saw normal human asymmetries and imperfections, part of me wondered if I was looking at inferior examples of human development rather than typical anatomy. The psychological impact extended beyond my professional life into my personal relationships and daily activities. I found myself studying people on the street, analyzing their facial symmetry and body proportions with the same critical eye I applied to medical images. At restaurants, I would catch myself examining the servers and other diners, wondering if any of them possessed the unnatural perfection I had witnessed in that trauma bay. That case changed everything for me. I left radiology because I could no longer trust my own interpretations. Couldn't shake the feeling that we're sharing this world with something that defies our understanding of human biology. Sometimes I wonder if that patient wanted to be found, wanted us to document her impossible anatomy before vanishing without a trace. I sleep better now, but I still find myself studying faces in crowds, searching for that same unnatural perfection. Maybe some mysteries are meant to remain unsolved.